morning ma'am, good morning classmate. I am Genesis Tamparong. Today I am going to demonstrate venoclysis therapy. Purpose of this is to provide electrolytes needed to maintain electrolytes in balance. And these are the material I am going to use. The sharp receptacle, cotton balls, dry cotton balls, pick-up forceps, 70% alcohol, the medicine, pair of needle, the cannula, the gauze pad, 2 kidney basin, 2 the venoset, the micro and the macro, then the PNSS, D5LR, and the Nomosol. PNSS 1 liter and 500 cc PNSS and 500 cc mannitol, and the splint and a pair of gloves. Now first, do hand washing technique, then in the procedure of the venoclysis therapy, there are 7 procedures. The setting up IV fluid, insertion, second is insertion of IV fluid, third is piggyback or side drip, fourth is follow up, 5 incorporation of medication IV fluid, 6 is troubleshooting, and 7 is the termination of IV fluid. And now I'm going to read the chart of the patient, the name, the age, the address, and the doctor order and the doctor's diagnosis. And first, do hand washing technique. Then put PPE and gloves. Then put gloves. Then the doctor's order is put D5 PNSS 1 liter to be inserted and regulated. Then when the cap of the D5 PNSS is dirty, get cotton balls and using pick-up forceps, then put alcohol, then clean. If it's dirty, clean, then discard. Then now open the cup of the PNSS, then get in the doctor's order is the macro venoset. Then first, before you open the
check.
Then get the macro venoset. Before you open, check first the size of the infusion set, then the integrity, then if there's an insect bite, discoloration, and expiration date. Then now find the flap, then open, then get the venoset. Then roll the tube. Then turn off the regulator. Turn off the regulator. Then first check I already checked the venoset. turn off the regulator, then open the cover, then spike to the D5 penises, then spike, push and twist, then hang the PNSS. Stop it. Ano? Stop it. Then now I'm going to prime the tube to remove the air inside the tube. Open the cover. Then open the regulator to prime the tube. Now the air is go outside and there is no air inside the venoclysis. Then now cover the tube. Then let it hang. Then now I'm done setting up IV fluid. The next is insertion of IV fluid. First, I'm going to inject at the metacarpal vein. First, I'm going to get cotton balls, dry cotton balls. Then, I'm going to pour alcohol. Then, I'm going to prep the skin where I'm injected. Then clean the totoro motion, then go wide, then discard. Then now I'm going to put a tourniquet to the forearm, then tie. Yeah. Then it should be not too loose and not too tight.
Kalit na lagi ko tayo.
Then now I'm going to get the IV cannula. First, before you open, check the size of the IV cannula. Gauge 19. Then check the expiry date, the discoloration, the insect bite. If there's an insect bite, none. Then now open the flap. Find the flap, then open, then get the venoclysis. Then open the cup. Then now I'm going to instruct the patient to make a fist. I'm going to insert the IV cannula, remove the cup. Then now I'm going to insert in metacarpal vein in 30 to 35 degree angle. Then when you insert, then 10 to 15 degree angle needle. Then slowly push. Then push the skin part. Then put those part. Then put those part. Then make a pressure. Then slowly remove the needle. Then cover. Then remove the goose pad. Remove the tourniquet. Then if there's an resistance of blood, I already prepared the PNSS. Then remove the needle. Then I remove the cup. Then inject the PNSS to backflow, flush back the blood inside. Then make a pressure. Do a pressure to skin. Then cover. Then anchor. Then anchor the cannula.
Dili, no? Ang taas. Then diaphragm dito. Ito sa sugilid.
Then now I'm going to insert the IV cannula. Insert the tube. The IV tube. First, remove the cap. Then remove the cover. Then insert the tube to the IV cannula. Then open the regulator. Then the doctor's order is 30 drops per minute. Then anchor the then anchor the tube. Then now put the splint. Now I'm going to put the IV tag to the IV fluid. Then write the name, the room number, the kind of solution, the regulation, the drug. Then the time started. Then the one who inserted the insertion. Then put it
Time and date.
cluster.
Time and date.
Then put the time and date
Gauge number.
and the gauge of the IV cannula. And now I'm done insertion of IV fluid. Next is piggyback or side drip. And the doctor's order is to insert the Manitol 500 cc. Then first I'm going to clean the rubber stopper of the wet because it's dirty. Get cotton balls with alcohol, then put alcohol, then clean the rubber stopper. Then next I'm going to get the micro venoset. First check the expiration date, the discoloration, the insect bite, and the size of the tube. Then open, find the flap, then open. Then get the IV tube. Then roll. Then open the cup. Then spike the IV tube. Spike, then twist, push and twist. Then hang. Then let it hang the tube first. Now I'm going to get the needle. I'm going to get the needle. First, check the size of the needle to be injected. Then the discoloration, insect bite, and the expiry date. And now open, find the flap, then open. Then get the tube, open the cup, remove the cup, then insert the tube, close the regulator, then get the needle, then insert first. Then first, get cotton balls with alcohol. Then clean first the injection port. And now I'm going to insert the needle. Remove the cap. Then insert the needle into injection port. Then anchor. Then the doctor's order is for the piggyback or side drip is 10 drops per minute. Oops.
Ano man?
Then let it hang. Then close the regulator. Open the cap of the side drip, the IV tube. Then open to prime the tube, to remove the air inside. Prime. Open the regulator, prime. Then the air is removed from the tube. Then close the regulator. Then close the cap. And now I'm going to insert the piggyback. I already cleaned the injection port. Then get the tube. Then insert, get the cap of the tube. Then insert the needle to the needle. Then now I'm going to inject at the injection port. Then be 10 drops per minute. The doctor's order is 10 drops per minute. Then, now I'm done in piggyback or side rip. Next is follow-up. And the doctor's order is going to follow up is the PNSS 500cc. And now I'm done in piggyback or side rip. First, put the IV fluid tag, put the name, room, kind of solution, and the number of bottle you insert. This is the number bottle number 2 and bottle number 1. Then put the tape. Then put the number of the put the cap of the needle. You insert. Then put the time, the date, and the number of the needle you insert. Then now I'm done piggyback or side rip. Next is follow up. Then the doctor's order is follow up the 500cc PNSS. Then the rubber stopper of the PNSS is already clean. And now I'm going to close the first bottle, the first tube. I'm going to close the regulator. Then going to get the first bottle, then kink the tube. Then get the tube spike. Then spike at the third bottle, the follow-up bottle. Spike the twist. Then let it hang. Then now open the regulator. Set at 30 drops per minute. Doctor's order. Now I'm done in follow up the IV fluid. Now I'm going to, next is incorporation of medicine to IV fluid. And the doctor's order is for medication is amoxicillin and inject in 1 cc. Stop, sir. Then inject in 1 cc. Then now I'm going to give a syringe. Then I'm going to aspirate meds. Introduce aspirate air first, then inject to the aspirating needle. Aspirate only how many cc we inject. Then the medication of the meds should be facing at me, and the number of the calibrator, syringe calibrator. Then introduce air. Then aspirate meds 1 cc. Then remove then attach the needle. First, I'm going to First, I'm going to get dry cotton balls. Then put alcohol 70%. Then get alcohol, squeeze. Then in the rubber stopper of the penises. And now I'm going to inject the meds at the penises, the follow-up. Then inject meds. Then pull. Then shake the bottle to mix the medicine. Then now I'm going to put the right thing. Then now I'm going to write the medication, the name of the medication, how many cc we inject, and the time and date. Date, the time and date. Then now I'm done with incorporation of medicine and to IV fluid. Next is then now next is the troubleshooting. Then now if the air inside the tube is above to in the regulator, you need to click purpose for the air is go up to the timber. Then if the bubble or air is below the regulator, then if there is no medicine incorporate, you need to pull the tube in the cannula. Then you need to prime to remove the air. Then if there's, since the medication, the penises have a medicine, you need to get penises using syringe, then inject. First, if the air is above the below the regulator, get the close first the side drip. Then remove the needle of the IV tube. Then put in the cup of needle, then let it hang. Then get a syringe. Then get a penises using needle, inject, aspirate air, then inject. Then introduce air, then aspirate penises. Then remove. Then inject to the tube. Then now I get the penises in the bottle. Then I'm going to inject into injection port. Purpose to remove the air inside of the tube because there are meds incorporated. Then before you inject, you need to kink below the injection port. Then inject the needle. Then inject the PNSS. First, open the calibrator.
Regulator.
Kink. Then inject the PNSS to purpose to go up the air. Then inject.
Okay.
Then the air is go up. Then remove the needle to the injection port. Then unkink. Then put again the piggyback or side rib. Then anchor. Then now I'm done troubleshooting. The next is termination of IV fluid.
Yan naman.
Then now next is the termination of IV fluid. First, I'm going to remove the piggyback. First, turn off the regulator. Then remove the needle. Then put into the cap of the needle. Put on the cap of the needle. Then next is the splint. Remove the splint. Then get slightly moist cotton balls to remove the plaster. For easy removing, remove the plaster. Then remove. Then get, before you remove, put the dry cotton balls with plaster, then make a pressure,
Live.
then push, then remove. The next is the first insertion IV fluid. Close the regulator, close, then get cotton balls with plaster, then remove the IV cannula, remove, then make a pressure, then check the needle of the IV cannula if it is complete. Then now let it hang. Then cover. Then now instruct the patient. Do not touch the plaster. Do not scratch and touch within 30 minutes. Then do not use your arm to carry any heavy things at least 8 hours. Then do the documentation. Then now I'm done venoclysis therapy. Thank you.